Hello, welcome to the Adult Type 2 video series. My name is Heather and I'm a registered nurse, and I'm going to talk to you about physical activity. Just a few reminders as you watch this video series. We encourage you to watch the videos in order, and just remember you can go back and watch the videos as often as you'd like. Fraser Health on the Road to Diabetes Health is a great resource to accompany this video series. And remember, you can pause the video at any time if you would like to spend a little bit more time reviewing the information. We would like to acknowledge that our work occurs on the beautiful, traditional, ancestral, and unceded territories of the First Nations of the Interior Region. We also recognize the Métis Nation and the contributions of the Métis peoples to the Indigenous ways of being and knowing on this land. In this video, we are going to discuss why physical activity is important, some things to consider before you get started, some ideas of how to be physically active, tips to keep going, and additional resources. Regular physical activity is one of the most important things you can do to manage and live well with your diabetes. By being physically active, you will have improved insulin sensitivity, which will help you manage your blood sugars. Some well-known health benefits of activity include improved circulation, blood pressure control, and lower cholesterol, which can help reduce the risk of heart disease. Like a lot of people, you may discover that being more active helps you with increased energy levels and overall fitness. You may feel happier, be more relaxed, and even sleep better. Before you get started, here's some questions to consider. Have you been inactive for some time? Or are you planning to increase your physical activity to be more strenuous than walking? If so, it's a good idea to talk to your doctor first. Your doctor can tell you what types of exercise are good choices for you. Next, do you have proper footwear? Ensuring you are wearing proper footwear is an important part of caring for your feet and avoiding foot injury. Are you taking any diabetes medication that might cause low blood sugars? If you're not sure, talk to your doctor or your pharmacist. Do you carry fast-acting sugar with you, such as glucose tabs or hard candy? These are important to help you treat low blood sugars. Do you have diabetes identification? If so, you should carry this with you when you're being active. And remember, stop activity immediately if you become short of breath or have chest pain while you're active. Becoming physically active can seem challenging, but it's easier than you think. There are a lot of things you can do to get moving that will all benefit your health. The key is to simply start moving a little bit more. Start small by trying to do a little more physical activity a week. Choose something you might enjoy. For example, if you like the outdoors, try a nature walk, gardening, walking the dog, or golfing. You can build up to more activity if you feel comfortable. Also, choose active options when you can, such as taking the stairs or walking to do your errands. Also, look for ways to reduce or break up the time you spend sitting. Limit your time watching TV or using the computer to no more than 2 hours per day. Also, try getting up briefly every 20 to 30 minutes. All of these things help increase your physical activity. Next, consider starting aerobic exercise. Aerobic exercise is any activity that elevates your breathing and heart rate. Some examples of aerobic activity are walking, swimming, aquasize, cycling, and dancing. You can begin by walking at a comfortable pace for as little as 5 to 15 minutes at a time. Consider shorter sessions and progress gradually. Your goal is to build up to 150 minutes per week. So, for example, that would be 30 minutes, 5 days a week. Next, consider adding regular resistant exercise. Resistant exercise involves brief, repetitive exercises with weights, weight machines, resistance bands, or you can use your own body weight to build muscle strength. When beginning resistance exercise, it is best to receive initial instructions and periodic supervision by a qualified exercise specialist to maximize the benefits and minimize the risk of injury. Start slowly and try for at least 2 sessions per week. Habits can be hard to change, so be prepared with a plan in case your motivation starts to fade. Do something you like. It's hard to stick to an activity that is not fun. It may take you a few tries before you find the activity that is right for you. Start slowly, even if it's tempting. Don't try to do too much at first. Add more activity bit by bit. Have a support network. Ask your family, friends, and coworkers to help you stay motivated by joining you in being active, such as a walk. Set small, attainable goals and celebrate when you reach them, and reward yourself in healthy ways. Seek professional help from a personal trainer or someone knowledgeable who can help you find a fitness regime that works for you. Know your community resources, such as community pools, gyms, and walking trails. And consider tracking your steps with a pedometer or an app that you can put on your phone. Regardless of age, making the decision to become more physically active is one of the greatest gifts you can give yourself. We recommend that you take a look at some of these additional resources to find out more information about being physically active. Thank you for watching this physical activity video. We encourage you to view the remaining videos for more information about living well with type 2 diabetes.